I'm here at the National Hospital for Nervous Diseases to investigate what is concussion, what harm it does to your body right now, and what are the increased risks of brain damage later in life, such as early dementia. The treatment for concussion is essentially bed rest and observation. There's no actual interventions you can do. However, there are some complications such as nausea, headache, feeling dizzy, which might require some medication. In the past, people never used to take concussion that seriously, and they would be back playing football or rugby within a week. But now it's recommended you do take a break from it, because repeated concussion or minor head injury can lead to earlier onset dementia, which we're seeing now in some professional sportsmen.
Sensible measures adopted by sporting associations are certainly making sport safer, and it must be remembered that the benefits of exercise during sport far outweigh most of the risks.
So sport has risks, obviously. You can hurt yourself, you can hurt yourself badly, but the benefits are just absolutely massive. It means that you can do exercise. It means that you keep your weight down, it keeps your mind active, it gets you out into the open air, whatever the weather. I think, to give up sport because you're worried about the risks is a disaster. Sport is really the best thing you can do to stay healthy, whatever age. I'm old, there are young people that do sport, old people can do it, why not? And I think it's part of longevity. Everyone wants to live long and healthily. That's what we can do by exercise, and sport's probably the best way to regularly do exercise.
Fortunately, the symptoms of concussion usually wear off within a few days, but there are some situations where a head injury can lead to more serious consequences, such as an intracranial bleed or a subdural hematoma. Intracranial bleeds can actually lead to permanent brain damage if not treated correctly. So if anyone's had a history of concussion and they start getting more severe headaches, particularly if you start lying flat and associated with nausea, or if they get problems with more dizziness or mobility, they must really present to casualty as soon as possible, because there are treatments available which are usually successful. We know that repeated head injuries can lead to an increased risk of dementia and other neurodegenerative conditions such as Parkinson's disease.
If you, a friend or a family member have had a head injury during sport, it's best to come off the pitch straight away and try to rest at least for the first 24 hours. If then after that headaches persist, particularly if they get worse when you're lying flat or associated with dizziness or confusion, it'd be really important to present to your doctor or the casualty, because this could, in a worst case scenario, be signs of an intracranial bleed.